Hi Ezra, how are you today?
I'm doing pretty well, thank you, doctor. I'm actually experiencing a lot of pain in my right ear, which is why I came in today.
I saw that in your chart, so we're definitely going to be looking at that. I want to ask you some questions about it.
Of course.
So first of all, verify your date of birth for me.
Yeah, January 1st, 1999.
Okay. And so when did the ear pain start?
It started about 3 days ago.
Okay. And tell me, what kind of pain? Is it throbbing, sharp, vibrational?
It's a throbbing pain, and then sometimes I hear things like an echo, or things like happening twice at different pitches.
Okay, all right. So reverberation.
Exactly.
Is it happening right now?
It is actually.
Okay, I'm sorry to hear that. It can be very disorienting, and also the eardrum is related to our vestibular sense. So have you been experiencing loss of balance or dizziness?
Well, I was at a punk show the night before, and I was in the mosh pit, so I think that might have been what did it.
That might have done it. That'll do it.
Yeah, I wasn't wearing ear protection, so
not advised. Yeah, so definitely probably some damage to the tympanic membrane. I'll take a look at it.
Do you think it will pass, doctor?
I think so. I'm going to take a look and see if there's any permanent damage. I can tell that by running sensory tests, also looking at the color of the membrane to see if there's any scarring or scratching. I can visualize it, and also I can just do some very rudimentary therapies like pulling and just to reorient and see where you are at the end of the session. And then next step would be to get some imaging done. But I'm going to do just a quick cranial nerve assessment of your eyes. And then we'll have you lay down in the bed. I'll check your sense of smell just to make sure everything is oriented right. And then we'll zero in on your ears.
Okay, thank you so much.
Yeah. Do you clean your ears regularly?
Only in the shower.
Okay. And how do you clean them?
I mostly just stay on the outside and behind the ear.
Outer auricle. Okay. And so on a scale of 1 to 10, how would you rate your symptoms right now?
I would say that they're about between a 6 and a 7.
Okay. Do they ever get worse at certain times of the day?
It hurts more at night.
Okay, that's common. And prior to the mosh pit, do you have any history of ear infection or ear problems?
When I got sick with the flu last year, I did get a double ear infection, but it's been thank you. It's been a little over a year since that happened.
Sure, and that resolved with antibiotics?
Yes, and just ibuprofen at the time.
Great. Any difficulty in hearing in general?
Besides in this moment, no, I would say that it's generally been okay.
Vision problems along with the hearing?
No, not that I've experienced.
Okay, I'm going to grab your vitals and then we'll dig in.
Awesome, thank you so much.
Sure. Okay. Go ahead and just breathe normally for me. I'm going to get a little cold to the touch. Okay, your heart sounds normal. Gonna listen on the bell side for murmurs. Okay. No S3, only S1 and S2. Alright. Get your blood pressure next. Alright. Go ahead and use this arm. Okay. 106/72, so that's very healthy. Okay. Let me grab your temperature. Any flu-like symptoms?
Not that I've experienced.
Okay. Okay, 97.8. Perfect. Excuse me. Okay. And gonna get your oxygenation. If I could see your index finger, just press it here, uncross your legs for me. Okay. Heart rate is 72 beats per minute. Oxygenation is 98% at room air. So your vitals are great. Okay. Before I have you lay down, I'm just going to palpate your head. I just want to feel for any lumps or swelling that may give me any insight to an impacted cranial nerve. Let me know if you feel any pain. Feel your lymph nodes. They're non-palpable. Just want to feel the back of your head. And no pain there? Okay. Go ahead and lay down on the bed, put your face up, and just get comfortable. And I'm going to perform a cranial nerve test and look at your ear.
Okay, thank you, doctor.
Okay, Ezra, so what I'm going to do is just brush back your hair and tie it up, just so that I can have better visualization of the ear, okay?
Okay, sounds great.
Alright, so I can just, there you go. Thank you. Go ahead and lay down and be comfortable. Just to get the hair out of the way. Go ahead and lift your head again and relax it. Good. Okay. All right. So before I visualize the ears, I'm just going to do a quick test of your taste and smell, okay? Just to make sure that this is an isolated incident, like you said, probably from the mosh pit, that there's nothing going on with neurological issues or cranial nerve being disrupted, okay? So go ahead and look straight ahead for me. Find a point on the wall. Open your eyes. It's going to look like a little bright light. Okay, your optic nerve looks healthy. Both nerves look healthy. No jaundice, yellowing, scratching or scarring. And I see that there is appropriate lubrication to both eyes. Alright, so I'm going to hold this chart right in front of you. Can you read this fourth row right here? O-L-C-F. Very good. And the row below it? D-H-J-B-S. Great. And the next row? E-P-T-Z-O. Very good. And the row below it, could you read it backwards? So starting with the J. J-H-D-F-C. And then again the last row, starting with the H. H-P-F-T-L. Okay, what color is this?
Green.
What color is this?
Red.
Which circle is larger, number 9 or number 5?
9.
Which circle is larger, 7 or 3?
7.
Okay, very good. So, let me know when my fingers enter your field of vision. Look straight ahead.
Now.
Okay.
Now. Now. Now.
Okay. And which fingers look closer to you? The fingers on your left or your right?
Left. Right. Both.
Okay, good. We're going to start with a taste test. Okay, I'm going to give you a testing strip. Open, close, open. What does that taste like to you?
Salty.
Okay, very good. And the second strip. Okay. Go ahead, open, close, open. What does that taste like to you?
Peanut butter.
Okay. That was supposed to be cherry, so I'm just going to make a note in your chart. Might be some issues there. And one more. Okay, open, close, open. What does that taste like to you?
Like sourdough bread.
So that was a testing paper, and so I think that would be pretty accurate. That most paper tastes like sourdough. I'm just gonna make a note of it just in case we have different findings. Okay. I have a few scents for you to smell. You don't have to get these exactly correct, but I'd like you to be close. Okay. So go ahead, close your eyes, and gently inhale. What does that smell like to you?
Cinnamon.
Okay. That was cedar. Okay. Okay, go ahead and inhale gently. What does that smell like to you?
Like orange.
Very good. That was grapefruit, but very close. This one might be a little tricky. Go ahead and give it a try.
I think it's like eucalyptus or lemongrass.
It's rosemary, but I think that's pretty close. Okay. And one more. Should be very energizing.
I think it's lemon.
Lemon, yes, that's perfect. So your sense of smell is intact. Not worry about that. Okay. So next I'm going to go ahead and take a look at the ear. Okay. If you go ahead and turn your head gently this way, I'm going to be looking inside. Okay, I see your tympanic membrane. It is definitely looks very irritated. Usually it's a pearl gray, but yours is purple and red, and I see that it is swollen. So definitely injury there. I don't see scarring and scratching. And a sign that the membrane might be dying is if it has black around the edges. And I don't see that. I just see it's very, very irritated. I see a lot of wax buildup here too, which might definitely be irritating the membrane compoundingly. So this gives me a lot of information. Go ahead and turn your head this way so I can look in the other ear. Okay. Seeing here that the membrane's actually healthy on your left side. Very, very light redness. So maybe you were biased speakers and your head was positioned in a way where your right ear was closer to the source of the music, or maybe just more sensitivity there. Okay. So that tells me a lot. Okay. I'm just going to look at the skin around the area of your outer auricle. Okay. Definitely seeing a little bit of dryness, dehydration, and then some slight flaking. And when you have flaking in that outer auricle, it can definitely flake off and get into the ear canal, which can cause further irritation. So I'm definitely going to be cleaning the whole area, sterilizing and removing some of the wax today. Okay. Alright, let me go ahead and look at the other side. Not as much here. Okay. So what I'd like to do is just do a few movement tests. I'm going to tug gently on your ear. I'm going to tug upwards. Let me know if you feel the sensation once, twice, or 3 times.
Once. Once.
Okay. And downward.
Twice.
Let's do it one more time.
Once. Twice. 3 times. Once.
Good.
twice.
Okay. Did you feel any pain? No. Okay, so both sensations were equal in both ears?
That's right.
Okay. So I have a tuning fork. I'm going to be making a vibrational sound. You should hear it and also kind of feel it outside of both ears. I want you to let me know when it stops, okay?
Okay. Stop. 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 Stop.
Okay, gonna be doing the same thing, just at a different frequency.
Stop. Stop.
Okay.
Stop.
Okay. Let me know which sound sounds louder to you, A or B. This is A. This is B.
A.
Okay. This is A. This is B.
B.
Okay. This is A. This is
B.
B. Okay, very good. Okay. And once more, let me know when the vibrational sensation stops.
Stop. 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 Stop.
Good. Okay, so I'm pretty pleased with that. Okay. I'm going to be making a crinkling sensation with my gloves. Let me know if you hear it in the left ear or the right ear.
Right ear. Left ear. Both ears. Right ear. Left ear. Right ear. Both ears.
Okay. I'm going to be whispering some things in each ear. Repeat exactly what you hear after me, okay?
Okay.
Christmas,
Christmas.
Halloween,
Halloween. Okay.
winter,
Winter.
summer,
Summer.
lawn chairs,
Lawn chairs.
engines.
Engines.
Good. Okay. And just a couple more sensory tests. I'm going to be applying a pressure point to your ear. Let me know how many times you feel that point, okay?
Okay. Twice. Once. 3 times. Once. Twice. 3 times. Once. Twice. Once. Twice. Twice. Once. 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 Twice.
Okay. Normal so far. Okay. Okay, so next we're going to do a sharp or dull test. We're going to do a reference point on your forehead. So does this feel like a dull sensation?
Yes.
Okay, and does this feel sharp?
Yes.
Okay, I'm going to be going around the ear area. Say sharp or dull. I'm just going to tilt your ear this way.
Sharp. Dull. Dull. Sharp. Sharp.
dull, dull, sharp, sharp, dull, sharp, dull, dull, sharp, sharp. Okay, go ahead and turn your head this way. Very good. As much as you can, remember to be comfortable. Dull, sharp, dull, sharp, sharp, dull, sharp, dull, dull, sharp, dull, sharp, sharp, sharp. Okay, and bring your head back to center. Very good. Just a few more here on the problem ear. Sharp. Dull. Sharp. Dull. Sharp. Dull. Okay. Sharp. Very good. I'm not too worried about that. Okay. Okay. And you're going to be feeling 1 or 2 pressure points. So say 1 or 2, okay?
Okay.
So say this would be 1, this would be 2. I'm going to be, of course, focusing on your ear.
Okay.
Okay?
1, 1, 2, 2, 1, 2, 1, 2, 2, 2, 2, 1, 1, 2.
Okay. A lot of inaccuracies there. Okay, let's keep going. Gonna do some on the face just for reference point.
2, 2, 1, 1, 1, 1, 1, 2,
Good.
2, 1, 1, 2.
And turn your head very gently.
2, 1, 2, 1, 2, 1, 1, 1, 2, 2.
Okay. Very good. I'm going to take a sample for our lab just to make sure there are no harmful cultures in your ear. It's important to know whether we need to apply antibiotics. also of the skin and the skin flakes. Okay. Excellent. We have just a saline solution that it will rest in. Okay. Forgot to put it in. Okay, there we go. So we're going to send that to the lab for testing. Now, I'm going to use an alcohol pad just to sterilize the outer ear, okay? Okay. So it's going to smell pretty strong, but just to ensure that it's sanitary. Okay. It might be a little red for a while, but it's not uncommon. Just gonna clip back this section here. Okay. Okay, perfect. I'm going to apply a little bit of serum to the outer ear, just to further cleanse. Okay, just tilt your ear this way. Perfect. Okay. Very good. So, just going to further inspect with a light. Okay, I'm seeing that flaking, and I'm going to be just gently scraping some of that off for you. Getting some of that debris out. Okay. Do you mind if I remove your earring?
Go ahead.
Okay. Okay. So, next, I do have a foaming cleanser that I'm going to apply. Okay. And it's going to be along all the outer areas of the ear, and I'll be gently working in. So just relax. This is really going to soothe the visible irritation of the membrane in response to the loud music that you heard. Your ear responded in a way that was very physically apparent to me with redness. So this is vanilla based, very powerful antiseptic that's just going to cleanse the area. Okay, you might feel a little red, might be red in the area for a couple of days, but that's normal unless you have an allergic reaction, which I've never experienced before with a patient, so you should be good. Okay.
I feel a lot of relief. It feels really good.
Good. It should just feel cool and soothing. Okay. Just brushing the area back here. So I'm going to be going more in the inner ear. Okay. Just scraping out areas that probably have a lot of debris from being hard to clean in the first place. Okay. Perfect. Really going to get the area behind the ear as well. Okay. Okay. And I'm going to take another tool, this honeycomb shaped tiny little ear cleaning tool, to just get in there. Your earring hole does not look irritated at all. So it doesn't look like your ears are sensitive in general, just sensitive to that level of noise. Okay. I'm going to apply some pressure point therapy to the outer auricle. Let me know if it feels painful and I'll stop. But this is what we call active repetitive ear seeding. There is sustained ear seeding, which would include actually placing sticker-like objects on your ear. I find that this method is more effective. Okay. Just going a little bit deeper in the ear. And behind. Okay. And while we let that ear rest, go ahead and turn your head. Okay. I'm gonna go ahead and get the other side very gently, because this ear is in much healthier shape. Okay, bring your ear back. Let's see. I'm seeing a little bit of redness, but it's pretty uniform, which means that the skin and the membranes in the ear are achieving a level of oxygenation from the pressure point therapy, which is just going to help the healing process. Circulation is always something we want to focus on so the body can heal itself Okay. Go ahead and measure just the ear, just for comparison. Or so if the ears are different sizes, it might present some problems. I see that your earlobe is connected. It's attached. Okay. Your left ear is a little bit longer. Okay. Just by a hair, but I'm gonna make note of that in your chart. Okay. Okay. So next I'm going to apply some cupping therapy just to further oxygenate the area around the ear and apply pressure relief because there's a lot of pressure built up in your membrane and I want to disperse that from the outside. Okay? Okay. So I'm going to apply just a little bit of serum here. Okay, and you're going to feel a slight suctioning sensation.
Wow.
Yeah. Alright, the sound is a little startling, but this is super effective. Do you feel any pain at all?
No, no pain.
Okay, good. I'm just massaging the area. Okay. Okay. Re-cleanse the area. Okay. Nice and clean. And just doing some very slight pulling to massage the membrane and gently allow blood circulation to normalize again. Alright, I'm gonna go ahead and sterilize your earring before applying it back onto your ear. Okay. Are you feeling a little bit better, Ezra?
Definitely better than before.
It's going to take a while for this to heal. I'm going to send you home with some ear drops, and I'm going to prescribe some antibiotics for you to take too, just in case. And I'd like to see you again next week just for some more of this type of therapy if you're interested.
Okay, thank you so much. I really appreciate that, doctor.
All right. Thank you so much for coming in. Go ahead, get up on your own time, and thanks for allowing me to do this exam.
Thank you so much, doctor. Bye-bye.